Sorry.
Or to venture capitalists.
Venture capitalists. So, and firstly, and another thing, I'm amazed by Dr. Neeti, 25 countries, 25 nations you travel, and how do you manage? It's an amazing thing. I would like to take it offline and understand how you actually, manage your time and all that.
And my husband's not divorced me yet.
Actually, it's very difficult, but yeah, I mean,
I've been married 35 years.
I'm also amazed how she's managing, but it's happening.
Now, a few questions on the main subject. How many healthcares you said about 25 healthcare startups you would want to do in the next 3 years? First year you're looking at about 10 to 12.
Yeah.
So, what are your criteria for shortlisting the candidates or the startups? So that this must be at least this is what you should be having.
So
would it be just an idea, or do you need a track record of something?
I'll tell you basically I'll tell you more generic, and then she can ask maybe more, sector specific. The key here is what is the unresolved problem they are solving, right? Like I gave you example of Impact Group. They were solving one of the biggest problem of India. We are not fully insured, right? They were solving a problem of, remaining money, which is out of 30 lakh, 20 lakh we were from my medical bills, right? So one of the big problem we were solving, and very large problem, right? Effectively, right? Track record of the guy was, he was Wharton MBA, Harvard guy, and the company came to me from Harvard Labs. So this was a problem identified in US of India, came to me, and we invested $2 million in that. Very super company. Almost every media has covered them. They're doing it very effectively. Now, when you're saying, what will be the selection criteria? So one is, of course, the ability of the person to deliver, right? Executor, very important to identify. Second, before that, what is the problem they're solving actually? Is it a really large problem? When he said, I said, I also felt when my mother was admitted in Nanavati, there was a bill of 25 lakhs in front of me, and insurance was not even 5 lakhs. That's a problem which everybody life is, some way or other, or you would have also faced. So it's a large problem, right? And very, very, very large problem. So that's what we look into when they come to us for the investment. And that's what we look at in any startup which reaches out to us. The patient the doctor engagement, this Wonder RX, was another large problem because Procter and all are trying to do it, they're not able to do it. Largely because doctors in any case don't have time, So you will have to go adopt their ways to get your job done. Very large problem. Every day they write at least 50, 60 prescriptions, converting that and, utilize connecting to the diagnostic center. It was a challenge. So we see, and who's the guy who did it? Wonder RX, Stanford guy, and also the guy who sold 2 startups. Last startup he sold to Dabur, right? So track record of the person, and also the concept, how big the business they are, how big the problem they are solving. More specific, I'd like to ask Dr. Neeti. I mean, if there are some spaces, what she see in India.
So there are some spaces which I alluded to right at the beginning, that the big things that you need to solve a problem for. So we will be looking in that space first. That's going to create impact for millions is what we're looking for. So we're not just looking, we're looking at those spaces. We know that there is a problem there. So there's chronic disease management, there's a primary healthcare space, point of care testing, diagnostics, in human genomics. Those are the spaces we will be testing, that those are the ideal, because we, again, like you asked, we're trying to create the health ecosystem, trying to find where it's going to create maximum impact. We also want to find startups that may want to work together in that space to create bigger impact. So again, that will be a criteria that we're going to be judging them for. How open are they to working with each other in that health ecosystem?
So these are some areas like she mentioned earlier, which is...
And what are the failure points of the entrepreneurs, the startup people? I mean, what you have got okay, there's one more question before that. How many healthcare startups you have already funded and already are under you?
So, like I said, we funded, you know, yeah, I'll just show you the names. Yeah.
Oh, fine.
So before launching, we also did our experimentation. So we funded four, and our experience was very good. Assure is in Mumbai, they have around 8 clinics, right? Dr. Abhishek Pilani is a known guy in that space, and he is now expanded to Bangalore and other cities also. The company is doing really well. Haswal is expanded. I mean, it expanded very fast. They're addressing the medical tourism problem. Impact Guru, of course, I told. Wonder RX, I told. So we had done four, and first one was $2 million. Second was $1.5 million. Assure was around $1 million, and Wonder RX is around $1 million, right? So we've done around $5 million already into that space, and we are now happy with our outcomes. What we are, and we are now seeing a larger market and large number of startups in India, and that's why this initiative.
And what are the common reasons for failure by a startup?
So in the healthcare space, I can answer that
Okay.
slightly.
Yes, that's
In the healthcare space, techies love tech. So they do technology or they develop a product and then they don't know where to place it. How do you scale it? How can you reach your 5.2 million people or your million people? So I think the biggest failure in healthcare is that techies getting really excited about something and they're not finding a place to put it. So the health ecosystem, the connection for the testing of it is really important. Two, I think sometimes the time is right. Today I think the time for healthcare is right in your country because you do have a sudden expansion of provider supply chain that we're going to be talking about. So I think that if that's not present, that energy is not present, I think it'll fail. And then finally, I think if you don't have the clinical expertise and you just have a tech expertise, it doesn't come together. That's a healthcare bit of it, and I think you can answer the commercial side.
I think the environmentals are definitely one part. The most cases the startup fails when the sometimes they come with great concept, but adaptability is very very weak. You know, and that's where the important role of POC is and important for us to sort of help us reach the place, the markets which are right for them. Sometimes India is not the right market for them, so why not take them to the market which is right for them, right? So that is the important thing, the and sometimes what happens, the they're not getting the right kind of funding. So with venture capitalists, because we have our global footprints, we take our startups to China, we take our startups for Dubai, we take them to Singapore, US, London, all places, connect them to the international VCs. So never a problem, right? So yes, we believe that startup fails because of two three things. One, sometimes they are very early in that ecosystem, like Dr. Neeti said. Now is the time. Ayushman Bharat announced, a lot of supply side, startups are required. A lot of startup they will have business to do. Right time. Second is their execution strength in terms of getting the POCs, getting the acceptability in the medical fraternity, and that's where the role of these mentors. Because sometimes the startups keep knocking the door, they're not able to reach you know the right place. With one recommendation of Dr. Nidhi, it can happen, right? And that's important. And yeah.
So that brings us to the next point. What is your role in supporting the startup? So what exactly you do? It's not, as you rightly said earlier, that you don't just provide financial support. You also do a lot of mentoring. So if you could just give a little more detail on what kind of mentoring you would be doing for the startup.
So I'll give you an example, that really helps you to understand, what we bring to the table. Again, going because this is a discussion around the this thing. We invested in a company called PSafe. This is into hygiene, women hygiene, right? And it's a product which basically, Harpic is around 700 crore market. Harpic cleans the shit part, but PSafe cleans the sheet where you sit into. So it sanitizes that.
Okay.
So it's a you go to the public toilets, women don't want to use it, right? It's a sanitizer which basically clear sanitizes the sheet. Very large market. So one product, PSafe, came to us. We connected to the largest FMCG distributor, and they also invested in them. Opened 80,000 distribution point for them in one shot. So for a startup, this kind of support is amazing. Impact Guru came to me. He said, "Bro, he's a Howard Wharton guy, Howard Labs." He said, "I want this kind of thing will click only when a hospital owner invests in us." So I get them two hospital owners to invest with us. And when they invested, they opened their supply to the startup. All patients of Apollo are using this service of Impact Group. Large market automatically got created. So the revenue impact, so the acceptability amongst the patient, so the life is changing. So startups need those kind of small helps than money. Money is definitely required for next 18 months. Every time they raise money, they raise for next 18 months. They will raise 6 7 times in their life cycle to reach to $1 billion company. But before that, this is very important, right? Today I got them on board, Haldiram. They invested in Wonder RX and Mercury Travels owners, the owners. So, when they invested in this company, and their inputs are very valuable. They're telling them how to grow, right? How to make it a very large company. And they said, rather than you, like this company was, a lot of pharma company was sponsoring that tablet. They said, don't do that. Make it a neutral company, right? Because your data should be neutral. Then only you can become. So, in this early stage, these kind of input matters a lot. So there are three things. One is opening doors, second is strategic guidance, and third is domain expertise. I may not understand anything about the
Sorry to
cancer.
interrupt you. I didn't understand this pharma company and that tag thing. So neutral tag in the sense.
I'll tell you basically. So this company gives a paper which is magnetically this thing. So whatever you write, doctors, it's captured in that tab. The tab is given free of cost to the doctors. If a startup give free of cost, they'll be bankrupt in 1 month time. So the pharma company sponsored the cost of that. Now the input came to him that don't do the financing from the pharma company, rather than form an NBFC, and there will be a lot of financiers available in the market who are ready to fund this kind of initiative if you're going to 1 million doctors. So there is an NBFC which we have formed, and the people who are putting money in that NBFC, which are going to finance these tabs, right? Like the way Rentamozo and lot of now the furnitures are funded by NBFCs there, right? Not by the investors. So there will be many who will be ready to, sort of invest only in that business. So they got the right guidance on that. Because if pharma companies sponsor it, if they will push their products through this. That's why they're bringing the neutrality.
But what if pharma company like they make their parent company and they because anyways due to government policies they're not supposed to give because of this
That's why.
SVP guidelines.
That is why. That is why this correction came by the guidance. But when you start up things now, they have small money. They have little money. They'll do everything to sort of at least keep it running for some time. When we came on board, we said no, this is not the right way. Let's do it this way. You want money for this? We'll arrange for this. Let's form an NBFC. We have some financiers who can put money only to finance this. That's fine. The model is in place.
Then they don't need the pharma company.
So we changed the
That's not the
business.
right
We
thing.
changed the business model of the company.
Is there any privacy issue there?
In
Privacy issue there?
No privacy issue now. No, no, no.
Prescription is getting shared to another
No, no. So it's not getting shared. It's going to the doctors. This only. Later on, it is going to the diagnostic chains if it is required directly, and it is going to the sort of.
So your question is very relevant. You're asking a question about privacy and data privacy. So again, that's the kind of guidance that we would give them. So I know exactly what GDPR guidance is required for data privacy for healthcare stuff. And what do you do then to protect your consumers' data? How do you protect that? And when you start off, your business model might not be the right one for that. So how do you protect that? How do you make sure you take consent from your patients when you're doing this? What kind of consent do you need? All that kind of
And how much
mentorship
data you
is
can
required. As far
share?
as what kind can you share? What can't you? You can also get caught up in a lot of red tape around the data. I mean, the UK data laws are much stronger than here, and they're enforced. They're not so enforced out here. But again, how do you stop getting yourself into pitfalls around that? And we have a team that can tell you how to do that. So we start with the right quality standards and the right clinical standards that you start with on data privacy, rather than going down the road and finding that you've done something horribly wrong.
How much amount are you looking at investing in the first year, in the first round?
Yeah. So typically, I say
Approximately.
so if I do maybe 10 startup in a year, which is $500,000 each, so that is 5 million in a year. And next 3 years, it will be maybe 15-20 million dollars,
Great.
right?
And
So,
what about the exits?
and if it's going well, it can grow further.
When you plan to invest some money, how do you plan your exit? You get it listed on the stock exchange and then
So
sell the shares?
typically, we run angel networks across India. So there is exits are multiple ways, right? When the larger rounds, because in a startup's life, it is 6 to 7 round of funding. I'm sure Flipkart,
Yes.
and Oyo, Ola, all of them raise multiple rounds of funding. So every round, when the larger round happens, the next investor like to exit the previous investors. So that is one. Second is the sometimes there are full acquisition happening, and especially the space like FMCG and healthcare, there will be a lot of possibility of full acquisitions because there are a lot of pharma companies, a lot of healthcare chains who want to enter, who want to upgrade their own technology, because startups are no way but to adopt new technologies for these larger corporates, right? So that will happen, right? And apart from that, there is always some new investors want to. So these are some very generic, I mean, these are very basic, four, two or three, which is existent, I'll say existing practices, which is happening. That's why, that's how people are getting exits in this. And some point of time, what happens, you go for an IPO, which is a dream. Indian markets not shown very good so far but sometimes you are very lucky that you get an IPO in your life. But that is a long shot.
Are you also getting any government support on this venture
I was about to ask.
that you are having already?
So startups are getting a lot of support from the government. We don't need any support, and we are a private incubation company.
But I have a question. Like government is also supporting lots of startups. So are
Yes.
you also looking tying up with government or some other startup like group of association kind who will like give you the right platform to have a right access?
See, government has laid down very good policies, right? This whole initiative is coming because of the Ayushman Bharat is in place, right? So government policies are helping startups. They have already a lot of incentivization for the startups. In the sense, our support system, we are, yes, we are very much benefited from the policies which are there. But as of now, there is no direct association of venture capitalists with the government.
Are you open for that?
Yes, we'll be very much. We're definitely exploring possibilities of associating and working with the government. I mean, this incubation center of venture capitalists, which is next to internet, it was inaugurated by Devin Furnaway. So yes, we are very much open with the government in, I mean, some way or the association. Uh,
So since Ayushman Bharat kind of generates a lot of data and information, and are you trying to, is the government allowing startups to access the data and
No. So absolutely not. So what Ayushman Bharat has done is opened up supply chain. So you're getting what the government has done very cleverly. It said announced 5 lakhs worth of benefit to a family of 4 over a year. It's a large benefit design. I used to be in insurance before, so I know that. It's massive amount. You got 500 million people that are going to be getting that benefit. But जब वो बीमार होंगे वो जाएंगे कहाँ? Right? So I think it's opened up a supply chain because public hospitals are not going to be able to deal with all this. And even the current private hospitals, where they are mostly in tier 1 cities. There are not that many in tier 2, tier 3, tier 4 towns and cities. So how are they going to deal with that? So the supply chain, suddenly Ayushman Bharat has opened up a new supply chain demand that's going to come in. I know lots of providers across the world now that are looking at India and saying, I'm just working with somebody on opening children's hospitals in Tamil Nadu. They're opening 200 children's centers. So suddenly the supply chain is opened up. In that same note, because you're going to have to have affordable healthcare, it's not Ayushman Bharat not going to pay you 100,000 millions to do, just hip operations or cardiac operations. So a bunch of supply chain that sits behind it. How can you make healthcare more affordable for government? So it opens up a market that allows then government to work with the new startups who are able to make healthcare more affordable.
Hence, more opportunities for the startups actually.
Yeah, big opportunity.
I've got some more questions.